What's the best cheek filler?
When you think of a youthful face, full and defined cheeks naturally come to mind. As you get older, facial volume decreases, making the cheeks looking flatter and more aged. This is mostly caused by bone volume loss as well as diminishing fat and soft tissue. Cosmetic fillers are the most popular option to enhance cheek volume. Stereotypically, patients with conventionally placed cheek fillers often appear overfilled, doughy, or pillowy. Assuming that it's the type of filler used that makes these people look unnatural, I'm often asked, what's the best cheek filler? In consultation, I'm also asked, what is the best cheek filler by people who've had filler done prior and felt the filler didn't last that long. I'll discuss different cheek filler options and what I do to help my patients look defined and natural and enjoy long-lasting results. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I perform cosmetic filler treatments every day in my practice using techniques to minimize bruising, which is particularly important in delicate areas such as the lips or the upper and lower eyelids. I apply my knowledge as a surgeon to perform deep and precise placement of hyaluronic acid filler for procedures such as non-surgical rhinoplasty. Technique is critical to successful filler placement. For example, I routinely apply a unique approach to bone level placement in order to enhance areas such as the cheeks, jawline, and chin for a more defined, natural looking appearance. This is in contrast to conventional techniques where filler is placed at the skin level, resulting in a less defined and more swollen appearance. During consultation for people considering fillers, they are often very concerned about looking bloated or doughy, characteristics seen in some celebrities or shown in stories about cosmetic procedures gone wrong. For some people who've had previous cheek filler treatment, there is also frequent concern about the longevity of their results. In addition, people who've had cheek filler in the past express frustration with the variability in their results and frequently experiencing bruising and swelling afterwards. As we're all aware, there is heavy marketing of fillers directly to the public, so it's not unusual for people to ask for a filler by brand name. The other side of this marketing approach is that many people blame their dissatisfaction with their results on the brand name of the filler used and actually less on the practitioner performing their procedure. So, when people look for the best cheek filler, they first want to avoid looking bloated and doughy, so they ask what filler can best help them avoid this unnatural appearance. As stated, technique is critical for optimal results. Most doctors place cheek fillers just below the skin at the fat and soft tissue level, below the dermis. In practical terms, placing filler to enhance cheekbone structure at the fat and soft tissue level is limited because the tissue structure is unable to maintain a shape that is intended beyond a small volume of filler. So instead of the cheeks looking full and defined, characteristic of a younger person, you end up looking soft and bloated. Since the soft tissue levels of the face can't hold much filler, the material migrates and spreads beyond the cheekbone area, making the face look rounded. So in order to avoid having a bloated looking face, it's not specifically the brand of filler, but rather the depth and technique of filler placement that matters. I place filler at the bone structural level. The bone structure is a more stable platform for the filler to be positioned. In addition, the material is held in place by the muscle layer over the bone, which prevents migration of the filler material. Through this approach at the structural level, your cheeks look full and defined, not soft or doughy. I refer to this method of filler placement as structural volumizing, which when performed in several other areas of the face, such as the chin and jaw angle, at the same time, is referred to as the Y-lift. Although placement of filler at the bone level is a non-surgical procedure, I apply my knowledge and experience as a facelift surgeon and facial implant surgeon to optimally place the filler at the proper level. A large proportion of injectors lack this surgical experience and make assumptions about where they're placing fillers. For example, they may feel that they're placing filler at the bone level when they take the syringe and contact the bone with the needle. Unfortunately, this is not delivering much material to where they think it's going. I use blunt-tipped cannulas instead of needles, and I'm able to glide through a space without traumatizing blood vessels or other important anatomic structures. This reduces the chances of bruising and other potential complications. In order to understand how I select fillers, it's important to know the difference between fillers and their optimal areas of use. In my opinion, hyaluronic acid fillers are the gold standard when it comes to filler options. Hyaluronic acid is naturally present in the body in areas like the skin and the joints. What further makes the use of hyaluronic acid fillers appealing for me is that they can be dissolved with an enzyme called hyaluronidase. This makes any procedure with hyaluronic acid more easily reversible. The body produces hyaluronidase as part of the normal metabolic processes related to your own naturally produced hyaluronic acid. This makes hyaluronic acid very biocompatible. Manufacturers produce hyaluronic acid fillers with different viscosities. Generally speaking, the thicker the hyaluronic acid filler, the longer it lasts. However, thicker hyaluronic acid fillers are not ideal for areas such as the lips, the eyelids, or the forehead. For areas such as the cheekbones, I have found thicker hyaluronic acid fillers such as Juvederm Ultra Plus and Juvederm Voluma to be very effective with longevity ranging from 1 to 2 years. Of course, there are competing products which are semi-permanent or permanent fillers. These fillers, which are often made of material that are actually resistant to the body's metabolic processes. With these fillers, there's a greater risk for foreign body reactions requiring medications and steroid injections, as well as the potential need for surgical removal. Should these permanent and semi-permanent fillers get infected, they cannot be dissolved like hyaluronic acid fillers can. I strongly advise against semi-permanent or permanent fillers. Although complications can occur with hyaluronic acid fillers, the biocompatibility and reversibility makes them, in my opinion, superior to any other filler option. Structural volumizing of the cheekbones is performed routinely in my exam room, taking very little time with little to no bruising or any significant swelling. Many of our patients come in during their lunch hour, making this a true lunchtime procedure. I routinely see my patients again after 2 weeks to see how the filler material has settled and if any enhancement should be considered. As for any elective procedure, safety is paramount. To enhance the cheeks, the use of natural hyaluronic acid fillers combined with precision placement techniques has been a very effective approach for my patients. I hope you found this information helpful. Thank you for your question.